Today I'm here to talk to you about the elimination diet. So this sort of diet usually lasts between 5 to 6 weeks, and it is specifically implemented to help people pinpoint any food sensitivities they might have. Problems in the GI tract can lead to hormonal problems, metabolic and immune problems. Now this leads to problems such as skin breakouts, brain fog, migraines, mood disturbance, joint pain and skin conditions. Now the elimination diet is great for people who know they have a food sensitivity but they're just not quite sure what food group it is. So this diet is really helpful for pinpointing exactly what food you're sensitive to. So usually weeks 1 to 3 or 4 is what we call the elimination phase. So during this phase, we're eliminating many types of food. We're really stripping down exactly what you can eat so that in weeks 4 to 6, we can slowly start bringing back foods, slowly start reintroducing them to your diet so we kind of know exactly what you might be sensitive to. So in the first 1 to 4 weeks, the foods we take out, there's a huge list of them, but here are some main ones. Your citrus fruits, your nightshade vegetables, all gluten, rye, wheat, corn, oats, your dairy products such as butter, milk, yogurt, soy, nuts and seeds, caffeine, sugar, and most of your sauces. So you can see that the elimination diet or the elimination phase really gets rid of most of your normal day-to-day foods. So after we've gone through about 3 to 4 weeks of this elimination phase, we can slowly start to reintroduce different food groups. Now it's really important that every week we reintroduce foods, we're only reintroducing 1 to 2 different types of foods. And that is because if we just introduce 1 or 2 and we get symptoms, we can be really specific and pinpoint exactly where your gut sensitivity is coming from. But if we pop in 4 or 5 new different types of foods, it's going to be really hard to decipher which food or which food group is giving you your problems. So it's important that you just reintroduce 1 food group, monitor your symptoms, in a week's time add another one, and so on until you've got most of your foods back into your diet and you're starting to sort of figure out what food you don't agree with. So some tips to help you get through your elimination diet. The first tip is to be prepared. Really have a look at the elimination food group so you know exactly what you're not allowed to eat. Go and do a big food shop and look at some recipes that are elimination diet friendly. That way you're fully prepared and you've got enough food to keep you going so you're not tempted by the foods that you're not supposed to be eating during that small phase. The second tip is to get rid of anything in your fridge or your cupboard that you're not supposed to be eating. Either pack it away or throw it out, give it to your neighbour, give it to your friend. That way you're not tempted to use it in your cooking, or you simply just don't fall back into your habits and use it by accident. My third tip, which is the most important one I think, is to keep a really strict diary. Now the diary needs to be looking at the food that you ate and your symptoms following what you've eaten. So that way you can have a little bit of a picture as to what's going on with your symptoms after you've eaten a certain food. And that way you can have a look at whether there are any patterns. So this is really going to help you to see what foods you might be sensitive to or what foods you're completely okay with.